our session for today is going to be looking at 3 objectives. We would want to improve our knowledge about the digital health. We also want to hear from young people and the experts on some of the key issues. And we would want to build a network of young people who care about their digital rights and health. So without any further ado, I'll leave this time to my colleague, who is also going to ask us to input in the chat box, maybe one of the key things that we think we might also take away from this session. But in this session, we also have 4 panel who are also going to be talking to us about the digital health and rights for young people. We have Caroline Njoronge from the Kenya Sex Workers Alliance. We have Dr. Tlaleng Mofokeng, the UNHRC Special Rapporteur on the Right to Health. We have Kate Pundok, Youth Expert, Tech for Health, and Boyan Konstantinov from UNDP. So later on in the session, we are going to split into groups so that we can also reflect on what we have had and some of the answers. But we will also come back to the bigger group and give feedback on what we have discussed in the group. We will also make sure that we use a couple of more Mentimeter polls to keep things interactive. So I'll now hand over to my co-moderator to walk us through the next part. Over to you.
Thanks, Inashi. And yeah, just to mention, we won't be able to have interpretation for now in the main room. We'll make sure to have interpretation in the breakout rooms. For now, you can always write down in the chat, and we will also make sure to send out the recording with closed captions for those who need it. For now, we are asking you, please share in the chat one thing that you would like to get out of today. And you can do that in whichever language you prefer. So please just write down in the chat one thing that you would like to get out of today. Rápidamente, no vamos a poder tener interpretación aquí en el cuarto principal, pero por ahora igual pueden escribir en el chat en español o en francés, y en los grupos pequeños sí nos vamos a asegurar que podamos hablar en español y en francés también. Entonces pueden escribir en el chat una cosa que les gustaría llevarse de la sesión de hoy, por favor.
So I also see some of the reactions from the team in the chat box. There's the issue of the effective knowledge management in using some of the digital tools. Then there's the issue of verified health information from verified sources, how to improve health services using AI. So those are some of the reactions that are also coming from the meeting participants. I also in Spanish.
Sí, cómo abordar la salud mental desde diferentes plataformas y herramientas digitales. That's an excellent input. How do we talk about mental issues from different platforms and digital tools? So thank you so much. Keep them coming. We will make sure to look at those, and hopefully we'll get some of those answers or just generate more questions during this session. We're going to move on to a few terms that you might hear today. So if you're like me, maybe you don't know about these terms. So to make sure that we're all on the same page and that we understand what we're going to hear today, I will run through some of those terms now and what they mean. So we have digital health, which is the use of technology to help improve individuals' health and wellness. And these include like all of these wearable gadgets, like watches or mobile apps that we use, and even robotic carers. We also have digital rights. When we talk about digital rights, we mean the universal human rights that protect everyone regardless of background in a digital space. For example, the rights to health, privacy, dignity, and freedom from stigma and discrimination. We also have data, which are facts and statistics used to analyze patterns for calculations and decisions. And some examples of data are age, date of birth, name, ID number, phone number, etc. Big data, which is like data that is so large that it cannot be stored in just one computer. So for instance, the information gotten from censuses and National Health Service. We also have metadata, which is data that describes other data. For instance, when we have a picture and it has like time and location of that photo, using that metadata, it can be possible to predict users' future behavior. We have cookies. We've all seen it when we go to a website. It says accept all the cookies. We don't know what that is, but we say accept all. So cookies are small files or blocks of data that a website sends to your device, your computer, your phone, to enable them to monitor or track you, what you do, and the other sites that you visit. And lastly, we have artificial intelligence, AI, which are computer systems that perform tasks normally, that normally would require human intelligence, making predictions or recommending decisions based on the analysis of data. So now that we are more familiarized with the terms used in the digital sector, let's go ahead and turn to our guest speakers. It's important that we protect the rights of young people in the digital age. So I'm really looking forward to hearing from this range of speakers. I will hand it over to Tinashe, who will introduce our first speaker.
Thank you so much for those terms. I think sometimes I'm also one person who accepts the cookies, but without exactly knowing what they mean. And thank you so much for that term. So allow me to introduce our first speaker. Her name is Caroline from the Kenya Sex Workers Alliance. Caroline is a sex workers' rights activist and the programs coordinator at the Kenya Sex Workers Alliance, based in Nairobi, Kenya. As a sex worker, she is passionate on realizing gender equality, community empowerment, capacity building, and diverse sex workers organizing. Caroline has 8 years' experience working with the national movement of sex workers in Kenya, focusing on achieving social justice, inclusive participation, decision-making, and designing of structural barriers interventions with, by, and for sex workers. So Carolina, where are you? Fantastic. Thank you so much for joining us today and agreeing to share your story with us. How have you been personally affected by the issues around data and digitalization?
Thank you, Tinashe. Good morning, good afternoon, and good evening to everyone. I will share a brief of how digital use affects mostly marginalized communities. And this applies, it cuts across most of the countries that do not have legislation for sex workers. And when I say sex workers, I mean sex workers in all their diversities, which draws across Lgbti, men who have sex with men, people who use and inject drugs. So we are growing in a world where everything is changing, how things were done before and how they are done now. But we are not putting in place we have not put in place, how are we going to protect the communities when an issue arises? In most of our countries where there is criminalization of sex work, like in our country, there is no guideline that protects the marginalized communities. And they introduce ways of collecting data of the communities in the name of shaping the programs and in the name of shaping the programs and how they can be able to capture numbers of the marginalized population, not knowing that it poses a great risk to the communities. And the risks themselves can impact the communities negatively, to a point that you find some are being attacked from their homes. And there are sex workers who have not disclosed that they are sex workers. And to make it worse, you can be a sex worker who is living with HIV like me, and I've not disclosed to my family members. And then this data lands to the wrong person. What happens to the data? Digital health is good. It has the power to increase access to and improve quality of health services, but also it poses significant human rights risks, especially to us, the communities that are criminalized in their own countries. As much as we require data collection to inform programming, through the experience that we have had in our country, where data collection through the use of biometric, where you are required to receive services and place your thumb for your identity, which in our country, when we apply for a national identity card, they use our fingerprints for you to be given the national identity card. That means anywhere that you put your finger, anything concerning you is disclosed. Where you come from, the village that you come from, anything that you have, you are a sex worker, where you frequent, the venues, it is disclosed because we use fingerprints to register for our national IDs. We have a case that has not been so long ago, where the use of biometrics really affected communities. It was introduced to one of the facilities that the sex workers were accessing services. Without the knowledge of the program person from the program, it leaked out to the journalist, and then it was given to the police to identify that this clinic offers services to the sex workers and men who have sex with men, and these are the hotspots that they frequent. It really brought violence to the communities. There was harassment. There was a swipe for the sex workers to be arrested. Our country did not have the privacy guidelines then. The privacy guidelines were developed. But as much as we have the privacy guidelines, who is held accountable on how the implementation of the privacy guidelines is being conducted? Putting in mind that the same government developed the policy, the privacy guideline, the same government implements the privacy guidelines, and the same government is the custodian of the privacy guidelines. What if the data lands to the wrong hands? Then what happens? How is the adherence of the privacy guidelines being conducted without even the knowledge of the people who you want to use? It's 17 data. Hours. And in this case, when you say you want to use the data of the communities, is it consented, or are you coercing the communities in the name of there must be a program that is being funded? So we are doing this for the purposes of the funding, but not to look at how we are going to protect the human rights of the individuals who we are collecting the data is with. There are so many ways that we can use apart from the digital way of collecting data. We can improvise using unique identifiers. Yes, Tinashe, you said that there are so many sex workers out there who are not on social media, who cannot access internet, who come from very rural areas. We also have the informal settlement sex workers, informal settlement communities who are not even digitally literate, majority of the communities are not digitally literate. How then do you want to use a digital platform to access health when you have not even empowered the communities on how to use the digital platforms? Then I think we still have a huge gap in that, where we are not giving the communities empowerment to understand the benefits and risks and how can they mitigate the risks. The other thing is that with all these contradictions that are at the heart of the digital health transformation, yes, we want to go to Twitter, we want to go to TikTok, we want to use forms of identifying and ensure that you do not duplicate Carol as 3 persons, but only 1 person. How will digital health intervention be a push for good? Are we doing it for the benefit of the communities? Are we doing it to improve health systems and promote quality of good health and well-being? Or are they going to contribute to increase of inequalities and harm to the young key populations? And I emphasize on the issue of the young key population, given that the age of consent does not allow them also to be in sex work, and at the same time they are young, so they are deprived most of the things. Thank you.
Thank you so much for those insightful words and some of the experiences that you have also shared. So up next is Dr. Tlaleng Mofokeng, who is the UN Human Rights Council Special Rapporteur on the right to health. Dr. Tlaleng, where are you? Okay. Hello.
Yeah.
Okay, great. So Dr. Tlaleng, UN Special Rapporteur on the right of everyone to the of physical and mental health. She is the Commissioner for Gender Equality in South Africa and a member of the boards of the Global Advisory Board for Sexual Health and Wellbeing, Accountability International, and the source. She has expertise in sexual and reproductive health rights, implementing various initiatives such as training for healthcare professionals, and her area of focus has been on gender equality, policy, maternal and neonatal health, universal health access, post-violence care, menstrual health, pregnancy care, and STI management. So Dr. Tlaleng, what do you see as the main risk that the digital technologies or AI pose to young people's human rights? And what advice would you share on how young people can make these tools work for them? Over to you.
Thank you so much, Tinashe, and good afternoon to all of the participants on this call. And just to say that I, have very interesting, colorful career, but one of the highlights has been how I managed to use social media and multimedia as a medical doctor, to give information on sexual and reproductive health rights, and in most instances, map service providers to patients. And the use of social media has really been important in bridging the gap between the information that's available and also giving it in a way where it's accessible. We are using the same sort of lingo online, and the space is less informal. So you have young people who are more able to ask questions that they may necessarily feel disempowered to ask in the consultation room just simply because of the power dynamics. So I think it's important, as we think about digital tools, as we think about the people who these are meant to benefit, to think intentionally about the layers of protection. And I think with the use of digital health, we need to pay attention to equity, in that there's still a digital divide in terms of geographical locations within countries, but also between countries in the different regions and globally. But there's also inequality in terms of the gender digital divide or the gap, where even in households where there are gadgets available, those gadgets are most likely going to go to boys, because a lot of societies are still socialized to think that it's only boys who should be in technology or IT. And the costs of data remain an issue that keeps many people away from access and away from utilization. Because even if you give people the technical know-how, unless they have gadgets and access to data at good speed, for example, they can't actually familiarize themselves with those technologies. And so I think the project and the issues around digital health and rights and usage are very important, and we need to locate them within a human rights discussion and use human rights frameworks and how we think long-term about what of those solutions can look like, because we don't want to exacerbate or compound existing inequalities. Many of those also, by the way, are not just gendered or in terms of geographical location, but they are also in terms of racial or ethnic lines, right? Where you have, for example, the use of artificial intelligence and coding that can perpetuate particular stereotypes, right, about Black people. They can be utilized in ways that track particular people. If you think about the impact of criminalization that many young people are living under, many countries around the world, I'm sure there's young people here who can't even use their real names or their real location, right? Just to even join this particular session where we are exchanging ideas. And so there's a real threat of violence and threat to safety and security that we also need to think about when we think of who are these technologies intended to benefit. And so digital technology is a great solution, but it is happening within a particular context, a political context, a socioeconomic context. And so it's important then to be very intentional and cognizant of all of the different moving parts and what it will take to really have universal access to digital technology and tools.
Thank you so much for sharing what this means to young people. We talk about our human rights. So as mentioned before, this session is going to be more interactive, and we are moving on to our next Mentimeter. And we are kindly asking young people below the age of 35 to participate in this exercise. If you are having any challenges with your Mentimeter, please also feel free to make use of the chat box. We would also want to hear from you on what do you think are the biggest risks associated with the digital technologies and AI. Please pick up to 3 options only, and if you cannot make use of the Mentimeter, please kindly type in the chat box, then we can also consider them as your submissions.
While we are working on that Mentimeter, we are going to have our interpreters just give a few pointers on what has been said in Spanish and French.
Muy bien, soy en general, Dr. Taleng ha dicho que ha utilizado su carrera, ha utilizado las redes sociales en su carrera para transmitir información sobre derechos sexuales y reproductivos, ha tratado de mapear los proveedores y los pacientes, y ha buscado cómo las medias sociales acortan las distancias entre estos dos, y cómo los jóvenes pueden hacer preguntas más libremente sin ningún problema de dinámica de poder que una consulta formal. Aún así, hay una desigualdad de género en el acceso a las tecnologías, pues se ven las tecnologías aún como una cosa más de chicos que de chicas. Otro problema muy grande es el costo de los planes de datos, que eso todavía impide a la gente de tener mucho más acceso a la salud digital, pues los planes de datos todavía son muy caros y la gente solo puede familiarizarse con los gadgets y con los apps si tienen acceso. Otro punto importante ha sido cómo se puede usar la inteligencia artificial o los códigos para perpetuar estereotipos, la criminalización. Por ejemplo, tengo certeza que algunos de ustedes acá no pueden usar sus nombres reales. O sea, todavía hay una amenaza muy grande en términos de seguridad y protección de sus datos. Carmen, please.
Ok, je vais essayer de vous donner un petit résumé de ce qu'on a été dit pour l'instant. Premièrement, avec le premier interlocuteur, nous avons entendu qu'il y a des problèmes de sécurité pour les jeunes, les personnes utilisant le numérique, l'Internet pour se protéger à cause de problèmes de sécurité en utilisant leur propre nom, parce qu'il y a des risques de violence reçus par les personnes qui se dévoilent leur identité et leur profession en tant que travailleurs dans la profession de prostitution, c'est-à-dire pour tout genre. Et il y a aussi, concernant notre deuxième intervenant, qui explique le problème de accès à l'Internet à cause de problèmes d'accès ou de coûts. Pour pas tout le monde a la possibilité d'avoir accès à Internet à cause parce que c'est cher pour certaines personnes, la connexion n'est pas toujours bonne dans tous les endroits. Les personnes aussi sont concernées par leur identité, de dévoiler leur identité en ligne pour des problèmes de sécurité également. Et voilà, ce sont les points principaux qui ont été dits par nos deux intervenants. Merci.
All right, thank you so much for that. I think I'll leave this time to my co-moderator to do reflections from the Mentimeter.
Hi, yes, thank you so much. So I do see that we have a lot of the number 2 in our Mentimeter, right? We have a lot of ones and twos also in the chat. So we're talking about believing that there's a lot of lack of policies protecting human rights in the digital space. I saw a lot of ones here in the chat, and weak privacy and data protection system. So very important that we need we need to make sure that our data is protected, right? That we are protecting human rights when we are using anything in the digital space, when we're using apps, when we're using anything that we are not aware of that is capturing our data. So very important to have that information here. Thank you, everyone. We're going to go ahead and pass to our next speakers. Just very important before we move on to make sure that we use the correct terms when we are speaking, and we use sex work and sex workers when we are referring to people who are working in that area. So we're now moving on to our third speaker for today. We have Kate, who will be joining us now. Kate Pandik is a research affiliate at the Mass Atrocities in the Digital Era Initiative at the Yale Genocide Studies Program, where she's concurrently her studies in policy and technology. She sits on the governance and strategy board of the Transform Health Coalition as a young expert with Young Experts Tech for Health. Kate is a student fellow at the Information Society Project at Yale Law School and began her work in digital health at Biobot Analytics at the MIT Little Devices Lab. She is passionate about exploring how young people can be involved in shaping global data governance initiatives, particularly around sensitive health data. Kate previously worked in government in the office of the Premier of Alberta, Canada. So Kate, coming from Young Experts Tech for Health, what is the most important issue for young people to be aware of in the digital health space, and how should young people respond to that?
Thank you so much for that question and for having me. It's really exciting to be on a panel with such wonderful people and talking to all of these youth from across the world today. So just to give a little roadmap of how I'll answer that question, I think the three general points are for young people in this space are trust your existing expertise, ask questions, and challenge policymakers and technologies to do things better for your community. So before I dive into each of those points, I'm just going to give a quick overview of what Yet4H is, so you get some context on where I'm coming from. So Young Experts Tech for Health is a platform for young people to shape the agenda towards universal healthcare through the responsible use of digital technologies. We have 12 young experts representing all 6 WHO health regions, some of whom are doctors, public health professionals, and public policy experts like myself, but all of us are youth. So as our name suggests, we believe that young people are already experts. Importantly, that they are experts who draw on a wide range of fields and lived experiences. Each of you brings something important to this conversation. You are experts on the needs of your communities, the ones you are already members of. Maybe that's a small town with no internet, or a community centered on your identity, such as race, sexual orientation, or disability. Whatever it is, these lived experiences are central to your health. And by valuing that expertise, you give voice to the challenges the wider community faces. Telling people they aren't qualified, that, hey, you're too young, or maybe you don't have the right degree or education, that's a tool to exclude voices that would often argue for human rights. So if you feel like you don't understand every digital tool or all the vocabulary, please don't let that stop you from speaking up and asking questions about the things that you don't understand. Often, technologists themselves don't actually understand the implications of the tools they build. So by asking questions, it's the best way not only to seek understanding, but also to force other people to consider the perspectives of your community in a way that they had previously not. Sometimes it can be really nerve-wracking, believe me, I know. But if something feels wrong about a digital technology, never be afraid to ask the really simple questions like, how is the data collected? Where is it stored? And how is it protected? If a digital health tool has been built responsibly, these questions should have really, really simple answers that are easy for anyone to understand. But if you don't get straightforward answers, you have to keep pushing, because that's probably a good indicator that the tool wasn't built very well. This takes me to my final point. Use what you learn from asking questions to put challenges to policymakers and technologists. Far too often, people with valuable insights about how technology will affect their community keep quiet because they're worried that their lack of technical expertise will make it difficult for them to get their point across. If this is how you feel, that you're concerned about technical interventions, but you don't know how to communicate them, organizations like Yet4H exist to help with that. Reach out to us with any ideas you have, or get involved through some of the opportunities on our newsletter, where we share different young opportunities for young people throughout the field. A great place to start, if you don't know where to start, is the current public consultation from Transform Health on the data governance principles that all of your input would be valuable in. My colleague Richard is going to put the link in the chat so that you can all follow up with that. But yeah, those would be my central points. Trust your expertise, ask questions, and challenge people on behalf of your community. Thanks so much for listening, and I'm really excited to chat in breakout groups.
Thank you, Kate. Thank you for encouraging young people to speak up. I think this is definitely why we're here, to make sure we are all feeling like the experts we are and make sure that we can ask all of the questions we need to ask. We're going to move right on to Boyan Konstantinov, which is our fourth speaker of the day. So Boyan, coming from the UNDP's experience, what do young people require from digital tools and AI, and how can young people meaningfully engage in the digital health space?
Gracias, Jimena. Buenos días a todas, todos y todes. Bonjour tout le monde. Hello, everyone. Happy to be here. My name is Boyan Konstantinov. I'm policy specialist with the HIV Health and Development Group of UNDP, currently based in New York. It's an interesting question, and it's a question that is also related to a concern that we at UNDP have and the international community has. It is what the Secretary General referred to as the dark side of the internet a while ago, which is used actually to undermine human rights, to undermine inclusion and human development. It is related to cyber crimes, which is actually a huge illicit economy that is likely to reach $6 trillion in 2021. It is related to unemployment and lack of opportunities to acquire employment because of automatization. But it also is related to incredible economic opportunities and structural transformation. So don't get me wrong, technologies, the digital technologies actually are a huge enabler, and it's something that UNDP sees as an immense opportunity for fostering inclusive development and to achieve better structural transformations. But we have to do this, as Kate put it in such a good way, responsibly. We have to know what the implications of our efforts are, and we always have to anticipate that not everyone is aligned with our agenda and with the right-based and evidence-based approach to health and rights. Young people are being involved actually in the responsible side and the enabling side of the digital. They are participating in the discourse that UNDP is contributing to, and we abide by this "nothing about us without us" principle, and they should continue to be meaningfully involved, and they should continue to approach us and criticize us if need be when their voices are not heard or their questions are not being addressed, their experience is not being acknowledged. This is very, very important. There are huge implications actually for young people in the context of health. There are huge opportunities in accessing HIV prevention information, for instance, STI prevention information, finding places where you can acquire services, asking for medical advice, and many, many other opportunities. But there are also a lot of risks, such as the spreading of disinformation and misinformation. And this is happening at a very fast pace globally. And UNDP is working actually on addressing the challenge of fake news, the challenge of misinformation, the challenge of spreading racism, supremacy, and cyber violence as well. I'm actually working right now as we speak on an issue brief that is addressing cyber violence among key populations with specific focus on young key populations. And this is an under-addressed topic globally. It's good if we openly speak about it and we openly engage young people in discussing what their experience is. Also, the same thing with an Lgbti inclusion index that UNDP is piloting in close coordination with global Lgbti plus civil society organizations, which collects data in 5 strategic areas. The indicators were developed actually with the participation of communities. They were very extensively consulted before they were developed. But also there is the need to ensure that these data are responsibly collected, stored, and used, exactly in order not to identify people, communities, but also not to reverse engineer policies in the case where you have forces that are not aligned with LGBTI inclusion. So that's why we have developed a code of conduct, a set of ethic principles that are basically fundamentally based on the do no harm and nothing about us without us principles, and guide the countries and organizations that are going to be involved in this data collection of how this should be done responsibly. And last but not least, I would like to touch base on a guidance on right-based and ethical use of digital technologies in HIV and health program. My colleague Kenna Essom has been leading the work on these guidance. I'm going to share the link in the chat in a second. Please take a look, and they will also provide a very good idea of how people can be involved and how what kind of principles should data collectors and data users follow when collecting, storing, and uses data, and also what to look out for. So there is a lot to be done. There are huge opportunities, huge, unprecedented opportunities, and we have to make sure that we use the digital for good, and that we are aware of the risks that are associated with this and not afraid to take steps to mitigate these risks in order to have a responsible use of digital technologies to promote inclusion. Thank you very much.
Thank you, Boyan, for reminding us that while we need to find ways to mitigate these risks, it is important to keep in mind that there's so many opportunities that we need to also make sure to take advantage of. And we are looking forward to reading that the code of ethics and the guidelines that you mentioned, and talk more about it in the breakout room. So we're going to give the interpreters just a few minutes so that they can translate the main points, and then we'll pass on to the breakout groups.
Muy bien, entonces Kate Pundik ha dicho que era increíble estar con los jóvenes aquí en esta reunión y que tienen 3 puntos principales: que hagan preguntas, que desafíen los responsables políticos para que hagan más por tu comunidad y que confíen en su experiencia. Tenemos una plataforma para que los jóvenes formen una agenda de usuarios responsables de tecnología, pues creemos que los jóvenes son expertos en una amplia gama de campos y sus opiniones deben ser apreciadas, independientemente de su comunidad o de su defensa. Valoramos sus experiencias y tratamos de darle la voz a las expectativas de sus comunidades. Creemos que menospreciar a las personas es una forma de excluirles del debate y siempre, otra vez reafirmo, que preguntar es la mejor manera de entender y hacer que la gente considere la perspectiva de sus comunidades. O sea, les encorajo a hacer todas las preguntas básicas sobre cómo las herramientas protegen y utilizan sus datos, y me parece que si ellos pueden responderlas bien, me parece que las herramientas tienen buenas intenciones, pero si no sabes cómo comunicar cómo es hecha la utilización de sus datos, me parece que tiene algún tipo de segunda intención. Y si no pueden, si no tienen sus voces oídas, que por favor busquen las organizaciones que tratan de abogar por estos derechos. Bien. Y en segundo, Boyan ha tratado de su preocupación del lado oscuro de la Internet y cómo este lado oscuro ha sido utilizado para socavar los derechos humanos, la inclusión y el desarrollo humano también. Por ahí hay un mundo de cibercrimen que movimenta unos 6 trillones de dólares al año más o menos. Y si por un lado estamos muy preocupados también con la automatización de los procesos, si por un lado genera desempleo, por otro lado puede ser un gran facilitador para fomentar el desarrollo inclusivo. Nosotros estamos buscando entender cómo podemos ayudar a este tipo de desarrollo. Los jóvenes están participando en el discurso de la UNTD y queremos que participen cada vez más y se acerquen cada vez más a nosotros siempre que no sean reconocidos, siempre que no tengan su voz oída. La tecnología puede ser una herramienta fundamental para el acceso a la prevención del VIH, para pedir consejos médicos y otros. Pero, por otro lado, hay algunos riesgos, como la difusión de desinformación, de fake news, acerca de racismo, de la supremacía blanca y la violencia. O sea, son temas que no están muy presentes en el debate público como debería. Nosotros tratamos de construir el índice LGBTI+, con la participación de la comunidad. Desarrollamos 5 indicadores, pero tenemos ahí el desafío de cómo almacenar y utilizar estos datos para que más tarde no sean utilizados contra la comunidad. Para eso tratamos de crear un código de conducta donde buscamos los principios de no hacer daño y nada de nosotros sin nosotros. Es muy importante el uso ético de la información sobre los programas de VIH y por acá les dejo un enlace en el chat para el programa que comando si queréis más información. Muchas gracias. Carmen, please.
OK. Pour notre première intervenante, Kate, qui fait partie de Young Experts Tech for Health, elle donne de l'importance aux jeunes qui travaillent dans les domaines et des communautés différentes, de toute race, de tout genre, et toute éducation, toute expérience diverse. Elle explique qu'il faut toujours, pour que ces jeunes-là soient valorisés, il faut toujours qu'ils posent des questions pour s'assurer de leurs droits. Tous les retours qu'ils peuvent fournir sont importants et ils sont importants pour l'apprentissage. Et il faut que les jeunes fassent confiance à leur expérience, à leur expertise. Tout le monde est expert, même avec un jeune âge. Elle encourage les jeunes à s'exprimer librement et on voudrait donner de l'importance pour que les jeunes, pour donner la voix aux jeunes. Et on apprécie les jeunes gens dans tous les débats. On considère toutes leurs perspectives et tout ce qu'ils peuvent contribuer. Concernant notre intervenant Boyan Constantino de UNDP, il a évoqué l'utilisation sur Internet de la partie sombre de l'Internet pour l'exploitation de données personnelles. Et il existe beaucoup de cybercrimes. Et cela a dû être coûté de milliers de dollars. Et on reconnaît que la technologie est une opportunité pour le développement. Et il faut se baser sur l'évidence et il faut que les jeunes sont encouragés à participer dans tous les discours. Les jeunes peuvent également critiquer s'il y a des lacunes et des aspects non reconnus. Et concernant il y a beaucoup de services fournis, tels que les services médicaux. Il y a aussi le défi de fausses informations, Il y a du cyberharcèlement qui sont subis et de la violence et ça se passe mondialement. Il faut en parler de ces expériences. Il y a l'aspect de les sociétés civiles LGBTQ recueillent des données et il faut s'assurer que les données soient utilisées correctement. Il existe un guide directeur concernant le soutien VIH, comment les gens peuvent s'appliquer là-dedans, les données qui peuvent être partagées. Le principe, c'est de ne pas nuire. Et il y a beaucoup d'opportunités d'utiliser les données numériques pour le bien, ainsi que les technologies. Il faut donc reconnaître, même s'il y a des risques, il y a des menaces, mais en même temps, les opportunités sont importantes et très, il faut le reconnaître et il faut être conscient de ces opportunités. Merci.
Thank you so much. So now we're going to move right on to the breakout groups where we will be discussing three main reflections. What needs to happen to make digital tools and AI work for young people and not put our rights at risk? What more do we expect from digital tools and AI? How they can help us overcome the challenges that young people face? And do you expect young people to be involved in making decisions in digital technologies? And if so, how? So now we will be going into the small breakout groups.
This time, we will leave this time to our speakers, 4 of them. So I will start with Caroline and also Dr. Tlaleng so that they can also share with us the most important take-home message for each and every one of us. What can we take away as young people from this session So Caroline, maybe you can wave so that we can have you on the screen. And also Dr. Tlaleng, if you can share with us the take home or the takeaway message from this session, especially looking at young people.
If I can go quickly, Tinashe, we have a storm and the electricity is doing really weird things. And I think I saw some sparks flying elsewhere, but I'll just make this short, just to say that I think that as much as digital health, in this space, we do understand it for what it is. I think it's important to still do the work of information giving and education and advocacy and reaching out to many other young people who may already be left out of these kinds of spaces that we are trying to create. And of course, acknowledging that we are all coming at this or many of us under-resourced or self-funded, as many of these youth-led organizations are. So how do we think about funding, about resourcing, about the longevity of the work, especially when it's led by youth? But I think it's important, and as in our breakout room are saying that the participation of young people is not something that we should be negotiating. It is absolutely necessary. And that young people must be at all of the decision-making spaces, policy-wise, resource-wise, coding-wise, and design-wise, and also in implementation, and not only be seen as end users or only as recipients, but also as people with expertise, firstly of their own lives, but with the expertise required to give us equitable solutions. And you can look forward to some of my reports in future as the special rapporteur, where I'll be dealing with some of these important elements of digital health and innovations and how they impact on the right to health more broadly. So thank you very much.
Thank you so much, Dr. Tlaleng, for being here. We really appreciate. Over to you, Caroline. I'm only giving you 30 seconds because of our time.
Thank you very much, Tinashe, and I'll pick up from where Dr. Tlaleng has left around the issue of ownership. If we, the youth, are the future, that means that we need to be at the center of everything, and it calls for empowerment about digital literacy. We need to move as a team, not leaving another cloud behind and having just a few people of the youth that we want to move with because they agree to our agendas. But if we empower all the youths digitally, that means that we can be able to hold our governments accountable as well when they set guidelines, when they tell us to use such technologies. And we are able to also ask why this, and we will proudly embrace digital health, develop a recommendation that are human rights based. That this can only be achieved when we are well digitally empowered.
It's 18 hours.
Thank you, Caroline. And I'm going to go ahead and give the word to Boyan so that he can give his closing remarks.
Thank you very much, Jimena and colleagues. In an inspiring discussion, I should say. What we had in our working group, I can summarize by addressing digital literacy and how to increase and update digital literacy among young people, acknowledging and addressing the digital divide, both in terms of people and communities, but also in terms of countries. And then language is an important issue. You see that even we technologically advanced people have some challenges with interpretation. What about the tools that are developed only in one or another language and don't account for the language diversity around the world? And last but not least, something that was brought at the very end of our discussion, and I echo what Dr. Mafokeng and Caroline actually also said, the need to develop and push for a responsible policy and responsible governance when it comes to digital and specifically in the context of young people. Thank you very much.
Thank you, Boyan. And lastly, we'll hear from Kate, your final remarks for the day.
Hi, everyone. Thanks so much for this discussion. And I think the short and sweet final remark is that this discussion shows that all of you have the tools and the ability to shape digital health in your communities. And so if you need any help or any more information doing that, reach out to some of the organizations on this call, and we'll be happy to point you in directions where you can make your voice heard or where you can learn more about the questions you still have. Thank you so much for all the inspiring conversation, and I look forward to seeing all of your faces as we keep pushing for change in digital health.
All right, thank you so much, everyone, for your time. We thank each and every one of us for being here. What is going to follow after this webinar is a blog, which we are also going to bring together and share, and also keep following the social media handles of all the partners that have also made this session a success. We have the Yet for Health, we have GNP Plus, we have Y Plus Global, we have Youth AIDS, and Restless Development. To those young people who also indicated that they would need more of data reinvestment, please, there's also going to be a follow-up communication after this session. We have to laugh and leave you at the same time. Time really flies. It has been 1 hour, 30 minutes discussing on the digital health and rights for young people. So from all of us and our wonderful colleagues behind the scenes, we thank you so much and enjoy the rest of your day. It's goodbye for now.
Yes, thanks everyone. And well, feel free, anyone who has to leave can leave. Those of you who would like to stay at the network for a little bit, we are going to share with you a Mentimeter, one last Mentimeter poll. If you can help us with choosing from the options for what needs to happen to make digital tools work for young people. So yes, we're gonna share with you in the chat if you want to go ahead and answer that question. And please feel free to share in the chat any last reflections that you have as well. And maybe if anyone wants to share anything, like speak, if you want to unmute yourself or raise your hand, we're happy to hear anyone who wants to share some reflections. Well, there seems to be a general belief that that young people need to be involved in decision making on digital tech. Thank you all. It's nice to see people who are putting their cameras. So if you want to show your beautiful faces, we will be happy to see you all. I see Swabri, you have your hand up if you want to talk.
Yeah, thank you very much for this opportunity and the organizers of this. I would like to thank you very much for this. Okay, to introduce myself, I'm called Mugera Sabru. I'm from Uganda. I'm a young person living with HIV and also an ambassador of young people living with HIV in Uganda. Moreover, I'm also have a degree in computer science, so I'm a developer and tech person. And a topic like this gives me a lot of happiness, and I feel like good somebody is talking about this and young people are getting insights about it. A lot of things are happening behind there. A lot of things we feel like they're not being put into consideration. So giving a microphone to young people talk about this is really great. I just hope that maybe the organizers should also take action among the points noted in this meeting, and we hope everything will be great. Thank you very much.
Thank you, Swabri, for your comment. It's definitely nice to hear everyone your experiences from your different countries and communities as well. So thank you for participating. Anyone else? I see in DG, you want to speak?
Yeah, this is Innocent from Kenya. I'm glad to be here following up the conversation. It's been very amazing. Actually, I've learned so much. Some of the best practices from other places and what people think, their ideas. But my concern is just about how can we be able to make these conversations a daily routine or like our normal life issue, because you find that some of these conversations are actually done just maybe once or twice, and then people go silent. Maybe like the way you see today, from here you're going to make a blog, develop a blog, and then what next after the blog? Can you maybe have something like an action plan where we can come up with things that we want to be done in our different countries to just make these regulations to ensure that young people access the internet, they are at the center of everything. So I think it's better if maybe we could make this maybe let's say something like a normal conversation, because if you make it a normal conversation, the policymakers will get bored, and if they get bored, they obviously will have to work on what our needs are positively. Thank you.
Thank you. There was a bit of a problem in the line, so it was a bit hard to understand, but I think we got that there needs to be something more, and after this conversation, not just what happens in the room. And we agree, there will be a blog actually coming out with the main reflections from today. So we will be sharing that with all of you, and so you are happy to we're happy to have you like share it with your networks and engage with the blog, comment, follow like all of the organizations on the social media platforms as well, and we were happy to keep the conversation going for sure. Thank you.
Then the last issue is about can it be possible maybe we work like to form something like an umbrella or maybe a network where you can be working together to ensure that every country or every organization from different parts of the globe are benefiting from this effectively. Like if you say in Kenya or in Uganda they are advocating for this, we come together as a team and just push for the agenda and see to it that if at least if by bad luck it won't be adopted by the countries or the policymakers, at least we say that we push for something rather than just maybe leaving somebody or push for something on their own.
Thank you. Yes, sorry again, it was a bit hard to understand, but I think you said something about how do we make like our policymakers as well do something about these issues. And I think this is a very important conversation to have. And we need to be there as young people, like in all of the decision-making spaces, giving our voices, speaking up to make sure that in all of our countries, things are happening. So yeah, I totally agree that we need to do things in our own countries as well. Anyone else who would like to maybe say something?
it was also about movement building for all of us, movement building, just to ensure that it's not this thing, we do it as a sub-community or maybe a network. Let's say maybe if we are under democracy, democracy.
Thank you. This was perfect. I could hear you perfectly now. I totally agree about the movement building. Thank you so much. I see Eunice, you want to say something?
Yeah, I would like to say that youth should be involved from the planning, from the onset, onto the implementation. And also sometimes health programs can get a bit boring. And so using creative and innovative designs, and also in designing health programs or health products for youth, they should be consulted. It's just like designing a business or any product for consumption. They should be consulted in designing those programs, and so that the people tend to accept what is being developed for them. Usually people are ignored, and then the program is being designed thinking that's what they are going to need. But first step we have to take is understanding, communicating with the people and understanding what they really need. Like a lot of people would need internet, but maybe then there's no access to internet in maybe a very rural area. So it would be best to use like the resources that are available. Most people are using text messaging and all that. That's also another way of digitalization. So involving people in designing health programs, especially youth in communities, is really vital. Yeah.
Thank you, Anissa. I totally agree that we need to be involved in all of the steps from beginning to the end. Thank you so much. I think we have a couple of more questions or comments. So Miriam and then Tabitha, who wants to say something as well. So Miriam?
Okay, thank you for this time. Thank you for giving me this chance to talk. Thank you, everyone. I'd say thank you for good ideas, for being here. Yeah, I just want to say thank you.
Thank you for being a part of the conversation today and for being here and speaking up as well. Tabitha?
Hi, I'm Tabitha. I'm from Stop AIDS, which is one of the organisers, and I just wanted to say hi. Really, it's been a really useful workshop, but also just this last 10 minutes has been really helpful to hear the kind of desires that young people want and what's needed next, and just to say, hear that call that there needs to be more kind of action opportunities and like holding decision makers to account. And you know, I've been working with the co-organizers to host this, and the idea is that this would be a chance to kind of learn more about digital rights, but it's just great to know that you want to take more kind of action. And I put the Twitter handles for the co-organizers in the chat, just so you know, you can follow us and hear about upcoming opportunities. And it's a new and growing area for all of us, and hopefully be lots more exciting opportunities in future. Thank you.
Thank you. Yes, please go ahead and follow us on all of social media. Thanks, everyone. We have reached the end of our session today. Thank you for being a part of today, and I hope that you'll have good evenings, days ahead, and a great end of the week as well.
Thank you and bye.
Thank you, everyone. Bye.
Thank you, everyone. Bye.
Bye-bye.
Thank you. Au revoir.